Welcome to this mini module on blood glucose testing. This module was created for you by Educare, a division of Mirabel Management. My name is Jean Howell and I will be your facilitator today. Your learning objectives for this module will be to understand the principles of blood glucose testing. What, why, when, and how. Understand the proper technique for glucose testing. And last, identify normal blood glucose levels. What exactly is blood glucose testing? Simply put, it's checking a small sample of a person's blood to see how much sugar there is in it. Insulin gets the sugar into our cells so that it can be useful, but diabetics have lost the ability to produce enough of their own insulin, sometimes none at all, so their glucose or sugar accumulates in their blood, causing all kinds of health problems. Everyone needs insulin, so diabetics must get it through an injection. Those of us without diabetes depend on our pancreas to keep producing the right amount of insulin to keep our blood sugars in a healthy balance. Day in and day out, our bodies regulate the amount of insulin that is released, depending on how much sugar is present in the blood. Diabetics aren't so lucky. Healthy bodies self-regulate the balance between sugar and insulin. Diabetic bodies do not. Without producing much or any of their own insulin, how would a diabetic know how much insulin to take to balance his blood sugars? That's why we test the blood, to know how much sugar is floating around and how much insulin will be needed to keep those sugars in a more normal range. Just as blood pressure can change within minutes, so can blood sugars, and that is why many diabetics test their glucose several times a day. Other diabetics are more stable, and because their blood sugars don't vary greatly throughout the day, they may test their levels less frequently. The important part to know is that the blood must be monitored. Testing also lets the person judge how well they're reaching their overall treatment goals, understand how diet and exercise affect blood sugar levels, how illness or stress affect blood sugar levels, and to identify when levels are dangerously high or low. The doctor will advise on how often a person should check his blood sugar level. In general, the frequency of testing depends on the type of diabetes and the treatment plan. Type 1 diabetes is very serious and begins when a person is very young, so there will be many years he will have to manage this condition. He may have to check his blood sugar levels 3 or more times a day, before or after meals, before or after exercise, before bed, and even during the night. Glucose levels will have to be checked more often with illness, change of daily routine, or when beginning a new medication. If a person takes insulin to manage type 2 diabetes, the doctor may recommend blood sugar testing 1 or more times a day, depending on the number of insulin doses taken. Testing is commonly done before meals, after fasting for at least 8 hours, and sometimes after meals if instructed by the physician. Blood glucose testing is the traditional method, which involves pricking the finger with a lancet. A lancet is a small, sharp needle. Once you prick the finger, you place a drop of blood onto a test strip and then place the strip into a meter that will display the blood sugar level. Meters vary in features and readability. Some have larger displays or spoken instructions for the visually impaired. They also vary in portability, speed, size, and cost. Current devices provide results in less than 15 seconds and can store information. Meters can also calculate average levels over a period of time. Some of the newer meters allow testing sites other than the fingertip, such as the upper arm, forearm, base of the thumb, and the thigh. Testing at alternative sites may give different readings than the fingertip, which shows changes more quickly than alternative sites. This is especially true when blood sugar is rapidly changing, like after meals or after exercise. In 1998, the FDA approved a laser device that produces a precise beam of light that penetrates the skin on the finger instead of pricking it. This causes less pain and discomfort. The FDA says newer devices should not replace the traditional daily finger pricks. Blood glucose testing begins by communicating with your client what you're going to be doing. Then you will need to gather the supplies needed for the test. These include cotton balls, glove, the Accu-Chek machine or glucometer, test strips, the penlet and lancet, and a sharps container. Previous practice recommended to use alcohol wipes when cleansing the area to be tested. Recent studies indicate that this may interfere with the accuracy of the results. Now it is recommended to perform on a clean hand or wipe the area with a moist cotton ball. Wash your hands and put on gloves. Cleanse the fingertip with a moist cotton ball. Load the test strip into the glucometer. Use only test strips designed for the meter you're using because not all devices and strips are compatible. Gently massage or milk the finger toward the tip. Prick on the side of the fingertip so that the actual fingertip isn't constantly tender or sore. Gently squeeze a drop of blood onto the test strip, being careful not to have the test strip touch the skin. Bring the strip right up to the drop of blood and the blood will move onto the strip. It's magic! The client can apply a little pressure to the puncture site with a dry cotton ball or tissue. Eject the lancet from the penlet directly into a sharps container. The results will be displayed on the face of the glucometer in a matter of seconds. Read and record the results in the proper location.
Next, we will demonstrate the blood glucose testing. The first thing you need to do is communicate the client what is going to happen.
Hi, I'm Cheryl and I'm going to check your blood sugar today.
Thank you, Cheryl.
Next, gather all your supplies. You will need gloves, a penlet with a lancet, glucometer and test strips, moist cotton ball tissue or cloth, a dry cotton ball or tissue, and a sharps container. You will then wash your hands and put on gloves. Next, you will need to load the penlet with the lancet. The lancet goes inside the lancet pen. Remove the lid, insert the needle, and twist off the top of the needle and lay the plastic tip down until you are finished. Replace the lid and set the level you want the needle to poke. If you have thin skin, select a low setting. If you have thicker skin, move the notch up. Cleanse the client's finger. Load the strip into the glucometer. Gently massage or milk the finger towards the tip. Prick the side of the finger. Squeeze gently and draw a drop of blood onto the test strip. Have the client apply pressure to the puncture site with a dry cotton ball or tissue. Read the results and document. Eject lancet from penlet.
Normal range for blood glucose is 90 to 130. This range is according to the American Diabetes Association, and there are many variations to these guidelines. You should follow your facility protocol if client's reading is out of these parameters. Some actions may include holding the insulin, giving sugar, administering insulin, rechecking the blood sugar, or calling the nurse. If you have any doubts or questions about the reading, be sure to talk to your nurse. I'd like to thank you for your time. I hope that this module has helped you understand the reason for glucose testing and the steps to perform a glucose test. If you have any questions, please ask your RN. When you are ready, you may take the knowledge assessment that follows.